Welcome to Beauty and the Surgeon. I'm Dr. Jason Martin. I'm a board-certified plastic surgeon. I'm here with Amy, a certified nutritional therapist. And as we said before, we haven't really left. We podcast all the time. Nils, our producer, follows us around with the microphones, and we just wanted to include the people listening today into this topic that we're going to discuss. Is that correct, Amy?
Yes, that's correct. We podcast all day.
All day, every day, nonstop. So, the topic today that we're going to discuss is something that I think is kind of quintessential to plastic surgery, to aesthetic medicine. I just want to go back to the tenets of this podcast, empowerment, education, and transformation. So we believe in that. That's why we do this podcast. This is an educational podcast. It's resonating. Our analytics are improving, and we're going to stick to those topics if we interview people, if we're talking among ourselves. So today is about education. It's also about empowerment. And then ultimately, whatever decisions you make, it's about transformation. Go ahead, Amy. What are we doing?
Today, we are talking about when you need surgery and when you don't need surgery.
It's kind of like a philosophical question, chicken or eggs.
I always joke with that when I'm like, well, no one ever really truly needs plastic surgery, reconstructive surgery, yes, but no one needs it.
Right. You don't need it. I mean, there's a few things in plastic surgery where it's almost a necessity. Breast hypertrophy or very large breasts where they really aren't functional in terms of doing normal activities.
So I think that those is more as reconstructive.
Okay,
though.
but they're still considered quote-unquote cosmetic. People with severe weight loss with excessive amounts of skin that they can't move around, they can't do any normal daily activities, those are almost a necessity. But otherwise, yeah, you don't need it. The problem comes down to the fact that people go to different offices, and I would say a high majority of offices are not malicious or have malintent, but they go and get opinions, and the opinions are somewhat weighted on what that office offers.
That's correct, and I think it's important to note that because if you are seeking the opinion of a non-board certified plastic surgeon, they are likely not going to say that you need surgery.
And also, if you go to a board certified plastic surgeon and they don't have a certain technology, they may not say, hey, you need this technology.
Right, that you're a candidate for a non-surgical procedure.
So there's a thing called bird in hand. That's
yes.
like all of business. Well, you could do this really cool technology over here, but I don't have it, so why don't we do the old school thing that I've been doing for 20 years?
Yeah,
So,
or I'm not a surgeon at all, so let's just throw technology at you.
I mean, it's on every different level. It's kind of like it messes with your mind. If you're a patient, it's so confusing. And hopefully this podcast specifically will help people who are thinking about plastic surgery to kind of go through it from a logical standpoint. We talked about yesterday, one of the things that we wanted to do for this podcast, which we're not doing today, but I thought was a good idea, was how to read or understand research articles, right? So,
or where to find real information
right.
versus, hyped up Instagram, Google type information.
Which we're all over Instagram.
Right.
So what does that say about us? But I'm not going there. Okay, we'll just act like we're the most ethical.
And I still
around.
Google my symptoms if I feel sick, and I'm pretty sure I have brain cancer.
I totally
every
do.
time.
I think I have Parkinson's. I'm not even gonna lie. So it's very difficult for people. They don't even know how to read the research papers and the hidden truth of plastic surgery or aesthetic medicine is the research is, sorry for my French, is bullshit. Right? It's not even out there. It's not good.
Well, and it's almost always sponsored by the manufacturer.
Or if it's not that way, then it's just not great from a statistical standpoint. It doesn't have great science behind it. It's just very difficult for patients to understand any information. So then what you do is you go to someone like me who's successful, who's respected, and hopefully is honest, and I'll tell you my experience with this problem. Well, that's subjective. That's called anecdotal evidence. In science, if you went into a science meeting and you said, well, in my experience with this problem, the scientists would laugh you off the stage. Like, where's your data? Where's your statistics? Mm-hmm. Doesn't really exist. So what we're going to try to do today is give you a paradigm to follow to make decisions. And of course, it involves emotion. Of course, it doesn't involve all science stuff, but to give you some idea in different parts of the body whether you need surgery or not. So we're going to do the Amy and Dr. Martin head-to-toe scan. It's a scanner. It's an open scanner, just in case you're claustrophobic. And we're going to go through each area of the body and figure it out. Do you have anything else to add, Amy, before we start the body scan?
No, I say we start the body scan.
Okay, you go first.
Get scanning. Well, I think if you're starting from truly the top down, The forehead is where you're going to start.
Yeah, so forehead, brow lift.
Right. So that's the surgical option, is a brow lift.
Yeah.
And it's not super invasive, but it is a surgical option.
So they two different types of brow lift. There's an open brow lift, or three different types. There's a coronal brow lift, which puts an incision like basically from ear to ear in
Does
your hair.
anyone still do that?
Some OG plastic surgeons do that.
Yeah.
I mean, they're like 60 or 70, still holding on to that procedure. That's some crazy stuff right there. It works great.
Oh, yeah, it pulls at everything.
It lasts forever, but you also look like a weirdo.
Right,
With
and you
that
better
said,
have
it
a
works.
good
So,
hairline.
okay. And then the other one is endoscopic brow lift, which is small incision. They use a little TV camera, cannulas, and I don't want to get too far into the procedure itself. And then what we do, which is even probably lesser invasive, which is more of like a hairline incision. Brow position is really subjective, just like everything we're going to talk to today. So if you feel like your brows are a little bit low, but not a lot low, I would highly advise people to put off a brow lift for later and try the less invasive things, which are what? Botox?
Botox?
Yeah.
That's probably the main thing that you can do to kind of address your brow position. I do think, though, it's important to state that I think a lot of people are really afraid of a brow lift because they don't want to look really startled.
Right.
But for some people, and we'll get to the eyes later, they think they need their eyes done, but what they really just need is a change in that lateral brow position.
Yeah, lateral is the outside. Toward the
Yeah.
ear.
So like it's, if you kind of like just pull up from the hairline right there, it's so subtle, but it just really kind of helps brighten and like give you that youthful look of your eyes back without needing something done to your eyes. So like sometimes that is the case, and you can kind of see that if you have Botox done really well. You can almost kind of lift that brow a little bit to kind of mimic what that result would almost be like.
Yeah.
So if you're really liking the results that you get from Botox in that area, a solution for you, the surgical solution, may be to do a brow lift to get a longer lasting result like that.
Right. So I think that's a really good point. When in doubt, if you're confused, you don't know, you're in the middle, you're on the fence, whatever the doctors are saying to you and whatever you feel, always go with the less invasive option first. If it's a thing like Botox, which gives you a set amount of time to see what it's like, and then you can move on to a brow lift.
Yeah.
The second thing you said, which is really important, are you a plastic surgeon?
No, but I know one.
Oh, okay. So if you have problems with your eyelids, specifically your upper eyelids, sometimes you can do a brow lift and avoid having to do the eyelid procedure. Most of the times you have to do a brow lift and the blepharoplasty, which we'll have a podcast on that. But you can sometimes just do a brow lift, and a lot of people like that, and the results are great. Do not fear a brow lift. So again, do we do surgery or not? Brow lifts have a bad connotation because of the old results. These days, it's subtle, it's nice. We do most of these in the office under local anesthesia. You should have a low threshold for deciding to do it if you're a candidate for it. And specifically what that means is if your brow is below the edge of the bone, okay, the around your orbit. And we'll get into that later on, but specifically from a physical exam standpoint, when you look at it, and also from, when you palpate it and feel it, and also from the way it looks in your appearance. So brow lifts, I think low threshold. I think start Botox first. The Botox would be in the crow's feet area higher up on the outer part of the brow to lift the brow to give you an idea.
Yeah, and a couple of things to think about with downtime for each of those procedures or cost. I mean, Botox injections are going to vary based on the part of the country you live in, how many units they use, but you're looking at least a few $100s to try a Botox injection there, on both sides. Downtime is minimal. It's very rare to have bruising or swelling with Botox. Your results kick in about 7 days and last at most 3 months for most people, depending on how you metabolize it, especially in a really mobile area like around the eyes. Brow lift, you definitely are going to have a little more downtime. You are going to have some bruising, probably for 1 to 2 weeks. Not a ton of swelling, but the first few days you will be swollen. You'll have sutures that need to come out in about a week.
But Amy, when you look at our before and afters, the patients look bad beforehand and great afterwards.
That's
so where's
true.
the bruising part?
Right, it disappears.
Okay.
1 to 2 weeks.
So I think, to that point, that's one thing that's hard for patients because they don't know what it's like to recover.
Right.
And so that's a really kind of a nebulous thought, right? Oh, I'm going to have bruising and swelling. I don't even know what that looks like. Doctors don't even show patients what that looks like. We try to.
We try to, if we have pictures of it.
Pictures,
yeah. And it's also not a lot of people want their picture taken when they're not looking great.
Right.
But you can expect the results of your brow lift. It's not probably the longest lasting surgery that we do because of the mobility of the area and just gravity is continuing to pull. But I would say a well done brow lift done at the right time is going to give someone, at least probably 5 to 10 years.
And maybe even longer, especially the way we do it, which is on the hairline.
Yeah.
So you have 3 different ways to do a brow lift. We do the one that's, I think, the most permanent, besides the super aggressive incision from ear to ear.
Right,
on the
which
hairline.
is just not a great option.
Yeah, which is called a corona brow lift. Okay, brow lift, eyelids, upper and lower. So that's, the area that first shows evidence of aging and changing. I mean, you can even see it in people in their 20s, right?
You can. Yep.
They start to get the bags underneath their eyes. Some people have familial fat deposits there. Some people have familial, meaning they were just runs in their family, extra skin on top of the eyelids.
Like heavy eyelids.
And we've had some patients where we've done surgeries and they're in the low 30s.
Yeah, or even
20s.
late 20s, yeah, with just very, very heavy eyelids.
They were 100% candidates.
Yep.
So when do I need to get a blepharoplasty or an eyelid procedure? This is a difficult one.
It is, and it's, I think, a lot of the signs for most, let's start with women, because I think they start to see some of those signs sooner because they tend to apply makeup in that area. And you start to realize that, like, you're running out of space, right? Like, you have no more space to put, like, eyeshadow on because now it's all creased.
Right.
You're losing that space because that skin is becoming looser and kind of folding over itself. So a lot of women start to complain of that. They start to complain that their eyelashes are touching the skin. So those are definite indicators. If you've got those things happening, your skin is touching your eyelashes, you have so much skin that you have to like lift your skin up to put eyeshadow on, but you can't see it anyway because it folds right back over itself. There's not a solution there that isn't going to include excising some of that skin.
Right, and then for men and women both, if the skin is hanging over your eyelashes, and especially if it's obstructing your vision in a forward gaze, you need surgery.
Or especially like if you lose your side vision.
Yeah.
Like you can no longer see your peripheral vision out to the side. You probably need that skin excised.
Insurances, when they pre-search you, if you're going to get this kind of eye tuck procedure, they look at your field of vision and they see where it's obstructed. They have this special machine in the optometrist's office. So the lower eyelids is the second area that you would be concerned about. Those areas tend to get herniated fat. There's not a lot of less invasive things for that. They also get crepey skin. So if you have mild to moderate loose skin and crepey skin around the eyes, upper and lower, you may be able to avoid surgery at least temporarily by doing resurfacing treatments. Radiofrequency or laser in that area can make a huge difference. It can improve it 20%, 15 to 20%.
Depending on the person, maybe even a little more.
Yeah. So that will buy you some time.
Yeah.
So if you don't know if you need it or not, you're on the fence, maybe consider one of these resurfacing treatments. You look like hell afterwards. You're all swollen around your eyes with these kind of treatments, but that's only for a short period of time.
Yeah.
Now, the caveat to this is, and something we didn't talk about, a lot of the times these decisions are based on price.
Yes, and that's why I kind of tried to address with some of the options that are going to cost less are also not going to last as long.
Right.
But what you can find really quickly is if you actually look at the price of, say, doing just an eyelid procedure, eyelid surgery.
That's my point.
Versus doing a series of laser treatments.
Yeah, it's not much different.
In fact, the laser treatments may be more expensive.
Well, because you're usually doing the whole face. And also, it takes me, 25 minutes to do the upper eyelids in the office with local anesthesia? That's a surgery, I mean. So it's hard there. I mean, that I would probably end up doing the surgery for the upper eyelids if you're on the fence.
Yep.
And and be conservative, and maybe the lower eyelids, which is a little more involved, maybe just do the laser down there.
Or even some filler. We didn't
filler.
talk about that, but filler, there are some newer fillers. Because the skin is so thin around the eyes, it's different than the skin on the rest of the face. It used to be that it was really challenging to put filler in those areas because either they were so thin so as to not show through the skin that they lasted like 8 weeks. So basically by the time you were no longer bruised, your filler was gone. Mm-hmm. So great trade-off there. Or
it's a great business model.
I know, right? Like
you have to come back every 3 months for their product.
Seriously. I mean, it was
It's like heroin or something.
Yeah, you got somebody hooked, so it looks great for like 3 weeks and then it's gone again.
Ugh,
or they were
companies.
they were so thick.
I guarantee they have a hyaluronic acid that will last like 12 years.
Oh, I'm
it's
sure.
Probably in some like lockdown safe somewhere that they're not going to bring out to the public because they would never make enough money on it.
Exactly. Well, no
Jerks.
one. Let's be real. From a provider standpoint, we wouldn't necessarily want to be injecting that either because it's not a great return on investment for us either.
You don't think we would inject that? We're that type of office.
I mean, maybe selectively.
Yeah, but we would do it.
Right.
We're not going to push someone away. If they're a candidate,
They're a candidate.
Yeah.
I mean, the cost would have to make sense for us to do that
Right.
once.
Right.
But there, used to be
you're too
that.
jaded. Used to be a lot more positive.
Like, we're going to do
It's really
everlasting
disturbing.
filler for $100 to everybody.
Oh my God.
So you had options of fillers that were very, very thin or so thick that you ran the risk of actually being able to visualize them,
Right.
or like you could see the ridge from them almost. It was hard to make them blend seamlessly.
But the new fillers like Volbella, Velour, all these whatever ones, they are thinner. You can do more superficial. They last longer. They don't last 2 months. They can last up to 6 months, even sometimes a year. And they're great options. So low threshold to do surgery on the upper eyelids because it's easy surgery. It's less expensive to do it in the office with local anesthesia.
And not a lot of other options.
Yeah, and the lower eyelids, a little bit harder. Sometimes you have to do that in the operating room. So maybe wait on that or drag your feet on that surgery. Specifically around the eyes, Botox and fillers, dermal fillers are great options, and they can buy you some time. So,
and resurfacing.
Yeah, if the skin is just hanging over your eyelashes, you're going to need surgery. There's no way around it. You can't put dermal fillers in that, and you can't do a resurfacing. But
not enough Botox to lift that.
But if you're mild to moderate, kind of getting there, 30s, 40s, and you don't have a family connection in terms of terrible eyes, and you've seen families like that, like family portraits, they all have bags underneath their eyes.
Or they're all so hooded.
From
Yeah.
like top to bottom,
Yeah.
From any age group. You can do all these other things. And I think that the eyes are a perfect example of kind of waiting, buying your time and trying some other things as long as it's not so cost prohibitive. With that said, of the face, the upper eyelids is the first thing we almost always do on people. So it's the first surgery that people engage me for in regards to facial rejuvenation.
And that's usually, I would say, starting away from 35 to 42.
Right.
It's rare that you have someone who makes it past those early 40s without having their eyelids done if they're trying to really stay on top of things.
Right. And that's the one thing that we didn't hit on, but we'll keep hitting on points like this. It's better to do things earlier rather than later. So budget is one consideration, and then also the way you want to transform. If you do it earlier, then you look pretty similar, and it's kind of a subtle improvement over time. If you wait until your eyelids are hanging over your pupils and you can't see, and you do that on a Thursday and you come back in the office on a Monday and you have no more excess skin hanging over your eyelids, people are gonna be like, WTF, But in most cases, people don't wait that long. In most cases, they come in. All right, next place. Gotta keep going.
So let's just talk about the mid-face, because it is an area that definitely is affected by aging.
Yeah.
The surgical option addressing the mid-face is going to be part of a more involved facelift.
This is the worst area because people lose fat volume in this area with age, and they get what I say skeletonized. I don't know a proper layperson to say whatever. You just imagine that you lose a cherubic child face and you look like a skeletonized no fat face. And then what do? They go to the dermatologist or the medical aesthetics office, and they're like, I got the perfect answer for that. I'm going to fill you up with fillers, and then you come out looking like a freak.
Yep.
And there's so many examples of that now in popular culture. There's articles of people on reality shows like, I'm stopping this crap, because you can watch them when they're on reality shows. You see this transformation. They don't even look like themselves after 3 or 4 years. People. Yeah. And that's where those people, if they just would have gone to someone like me and done like a subtle face or facelift, it would have solved the problem. Mm-hmm. And you need a little bit of volume, but not a lot. So you need to reset the architecture and also add some volume because you've lost it with age. And that's where, ironically, I'll do some fillers there, but I'm pretty, if you're on the fence, I'm more likely to suggest to you to actually do a procedure, which is really antithetic to what people think I would say, right? They think I would drag my feet until the end. But especially for the mid-face, those facelifts really do make a difference.
Yeah.
In a way that's natural and subtle and nice.
Exactly, and it's kind of the same thing with the eyes. Like, if you time it well, so I always tell people, you just are going to continue to age well. It's not like you're going to start looking different. You're just going to keep looking good.
Right.
You're just going to continue to look really good. And, definitely we reach that point with patients who come in and, they've lost a lot of volume. They want a lot of filler. And, yeah, you could do a lot of filler on that person and make a subtle change. But there again, filler doesn't last super long, maybe 1 to 2 years at most.
So that's Voluma.
Yep. There are longer lasting types of fillers like Sculptra, that are going to be more permanent fillers, but those are, if you're not done by someone who's very skilled at using them, can leave you looking kind of odd, and they're hard to get rid of because they're not something you can dissolve with hyaluronidase.
It's kind of like our culture now is like filler crazy. And I think it's,
Well, it's 'cause so many people are doing it.
Yeah, and also there's a financial gain. And that's what's sad.
Easy money.
Easy money for these offices. People just go in and they're like, okay, you need filler. And, patients don't know any better, unfortunately.
Right, they're getting filler with their dermatologist, they're getting filler by their esthetician. They maybe have never even spoken with a surgeon to see if there's a better option.
Right. I don't think fillers are bad. I just really be conservative with fillers. And if you have skeletonized face or the fat pockets of your cheeks are down near your mouth, it happens with age. It looks like your face is melting.
Kind of face, yeah.
You're going to need to have that reset. And it's hard to describe that, but you know it when you see it. Just have a low threshold for at least talking to a plastic surgeon that does these cases.
Yeah, to see if you're there yet. And there are a lot of women that come in and they're in their maybe early to mid 40s, and you're just not there yet. You will be in several years.
Yeah, and we say that.
Yeah.
And we'll talk about some things for the lower face and neck that we do that's less invasive.
Yep.
Does involve the OR. So
while we're on the mid face, let's talk about the nose.
Oh, the nose, yeah. The nose, I love rhinoplasties. It's one of my favorite surgeries. We had a podcast on rhinoplasty.
We did, the nose.
Yeah, the nose. That's Amy's famous saying, and that also is time over time. What did you say about wound healing?
Time? That wasn't with the rhinoplasty. That was a different time.
No, but you had that kind of saying where time over time over time.
Time. Just
like
takes
Cyndi
time.
Lauper.
Time.
Time after time.
Time heals all wounds.
You have these sayings, these philosophical kind of sayings you throw out there. Is that how your mind works? Is that what you're saying to yourself every day when you wake up?
It just takes time.
Yeah, it just takes time.
Like everyone is just showing up the best they can in that moment.
So our rhinoplasty podcast is excellent. I love it. It's one of my favorites, actually. It's very informative. Pat ourselves on the back there. Right. And I love rhinoplasties, and I always want to do a rhinoplasty. But in most cases, you have to. If you have a really big bump on your nose, or if your tip of your nose is asymmetric or not shaped well.
Or if you have severe breathing issues.
Or your nose is way too wide. You've had trauma before, that's really common. You have a weird nose that goes from left to right, right to left, or left, right, left, right, left, right. That's like a...
Hockey.
Yeah, that was one of the rugby players that we had. I can't say his name, but his nose, I'm like...
What direction is it even going?
This is like, there's no GPS here.
No.
It's going around in a circle. Anyways, for those patients, you got to do surgery. But if you have mild to moderate deformities, and we talk about this all the time, you can do filler, dermal filler in the nose, and you can do it around the tip or on the bridge of the nose and make a big difference. If you go on our Instagram feed, one of our first posts, we're newbies still with Instagram, I guess, technically, and one of our first posts has a before and after of a young man who has a dorsal bump or a bump on the profile of the nose, and we injected a little bit of filler, and it looks amazing.
It really does.
And a lot of people respond to it. We're like, well, what kind of surgery did you do on him? We're like, we did 10-minute dermal filler injection. So that's an option. If you have mild to moderate problems, again, unfortunately, you're going to have to go see hopefully a board-certified plastic surgeon or ENT surgeon or someone who does this stuff on a regular basis. I love doing dermal fillers for mild to moderate deformities. I don't know a good way to say that for a layperson. Mild to moderate deformities, or
I would say it's going to be things that are on the
bridge of your nose.
Yeah, the upper part of your nose, so the bony part of your nose.
Yeah.
You wouldn't want to inject filler into like the tip or the fleshier parts of your nose.
And technically, it's contraindicated.
Yep.
I've done it. They worry about the blood supply down there, so you have to be very careful.
Yeah. But areas around the nose, if you're trying to smooth out the appearance of a bump, if you're trying to make it appear a little bit straighter, we can do that by kind of filling out the side that's not curved, you know? And I think most people kind of understand that, like you're bringing up the other side. Those kinds of things are great areas to address with filler. And there again, it's a great starter thing to do. If you think like, wow, I really don't like the way this bump in my nose looks, but I don't know if I want to do surgery. People are kind of afraid of rhinoplasties because there are so many examples of bad rhinoplasties out there. Do a little filler, see what that looks like to you by smoothing out that bump, and then see like, oh my gosh, like I really do love this.
Yeah, because the rhinoplasties are kind of like Botox for the brow lift. The dermal fillers, because it gives you an idea of what you can do. Yeah, and so that'll buy you some time, especially with men. Men are common because they don't want surgery. Primarily most of our patients are women, so the men don't want surgery, and so we do dermal fillers, and they can see, hey, wow. And universally, when you do the dermal fillers, and what do they say every time when you show them in the mirror? They're like, holy cow.
Yeah.
Or like, wow. They say other words. But they were like, wow, this is amazing. So we love dermal fillers in the nose, but more importantly, we love rhinoplasties. And if you need that, you need that. There's no way around that, especially if you have breathing issues and all that kind of stuff. So that's not one where it's hard to decide.
No.
It's kind of like just do it or don't, or accept the fact that you got a jacked up nose.
Right.
Okay. Next area. Let's say jawline and neck, maybe.
Let's hit the lips first.
Ugh.
Because they're in the middle.
Ugh.
So it's actually, people still do call our office and ask if we do lip implants.
Yeah.
And, you know, I think that I don't know a lot of providers who do them. Lip implants, lips are a very, very delicate, sensitive area of the body. And if,
yeah, the lips are amazing. It's a kinetic area. It's involved with, talking. And by the way, when people look at you, they usually look at your mouth or your eyes. Mm-hmm. So those are the two areas that people want improved. I mean, inherently, right? They know that because I'm looking at Nils right now. I'm looking at his eyes. I don't look at his mouth because it's covered by a Nordic beard, unfortunately. So we need to shave Nils so I can look at his mouth too. So from that standpoint, I get why people want to enhance their lips, right? And it makes total sense pragmatically and logically. But somehow we fall off the edge of the reservation, and then we get way out into weirdo land. And half those people come in our office and like, what can you do to help? I'm like, well, the first thing we need to do is literally bind your hands together so they can't reach in your wallet so you can pay for any more injections. Right. Like you need to take a step back.
Leave your lips alone.
Right. I always think for the lips, a conservative approach is really good. Implants, I'm not saying I'm against implants to the lips, but those are permanent, and those can have a lot of problems with them.
Well, I would almost say they're not permanent, and that's the problem. I think that
yeah, right. And that's the conundrum, because they can get infected, they
yeah.
can extrude, and
they
there's
can
a lot
move.
of problems. Yeah.
Like there are a lot of problems. It's not like you're putting an implant under a muscle.
Right.
When you put it in the lips, you're putting it into soft tissue.
So the surgery would be implants. It's not a common surgery these days, even though in a specific type of people it can work, especially post-traumatic injuries.
Right. Sometimes a traumatic injury
Yeah.
or like a severe, like a birth defect.
Yeah, exactly.
You know, like in those cases, yes, it's an amazing option.
Right. But I mean, and there's some people in this field that do that a lot, and I don't want to throw them under the bus because that's their thing and that's their area of focus. But yeah, if you're going to do an implant, maybe just go to someone who does that on a regular basis,
That's what I was
and
gonna
that's
say
their
too.
thing.
Yeah.
Don't just go to some random office and we're like, oh, we're trying this new thread thing where we go through your lip, just like immediately walk out. Secondly, just ixnay a little bit on the fillers in the lips. Like go down to a normal level, right? And that's fine. The Kylie Jenner look, that's okay, but maybe do half Kylie Jenner, not the full Kylie Jenner.
Well, and I think with lips specifically, I think what people tend to do, and I'm saying people, injectors tend to do, is really over-inject that area because it is a mobile area. There's a lot of blood flow to the lips. Your filler wears off faster. So they're trying to make someone really happy, but like then they get so used to their lips being so big, when it starts to wear off, it's just that you're noticing that difference, so you want it back to where it was. So I think it's kind of a vicious cycle.
Right.
Like injectors are over-injecting a little bit to really make a powerful statement and also to get the filler to last a little longer.
I don't know, I'm morally opposed to that, and I don't give the injectors any slack.
No, I'm not. I'm just saying, like, I think
that.
that's how
So
people
if I'm
get
not
into
doing
that.
it, why should they do it?
Yeah, I'm saying they shouldn't, but I think, you look at everything from a cost perspective, right? They're trying to keep people coming in. You want people to think their money is going far. And it's important to note, with filler in the lips, your lips are mobile, they're very blood filled. Like that's going to break down the filler faster than like say in your mid face.
I mean, I'm a big believer in business growth, and I'm a capitalist. I got
Right.
all that, but I'm also a believer in being ethical and doing the right thing.
Well, and
I
wanting to
think-
be proud of who's walking
Right.
around with you.
And the other problem is the injectors, their aesthetic eye may be totally distorted. Maybe they want that. Maybe they
Right.
think that looks good.
They
so
might.
anybody listening to this podcast, if that's what they want, clearly they found out through this podcast that Dr. Martin's office is like not down with that program. So
No, we do beautiful filler in the lips.
yeah,
but we
I
do
love it. We do it
conservative
all the
filler in
time. We do it all the
lips.
time.
Yes.
it's just you always have to deprogram people.
Yeah.
It's like yeah.
Well, not always, but if you're looking for giant Kylie Jenner lips, you're probably not going to get them with us.
Okay.
So, and
Let's move on from
lip
Kylie
injections, we're definitely not
Why
going
did you have to bring that up? I thought we could skip the lips. It's the one hot button issue for me.
But we don't do lip implants, so that's easy.
Yeah. Okay. Next one.
Yep. Let's talk a little bit about the ears before we get into the rest of the face.
Okay, so ears, really not much you can do with injections. Definitely for the lobe of the ear. When you get older, it gets wispy and loses its fat, and it's pretty
Really
amazing.
thin,
Real
yeah.
thin, so you can put some filler in there. Also, if you have a little bit of a ripped piercing hole, you can use filler around it to bolster it. But more than not, the problems with the ear are going to require surgery. If you have prominent ears or asymmetry of the ear, or your earlobe itself is too big, and that also happens with age. It gets more pronounced and hangy, and those all involve surgery.
And if you've had an earring ripped through, that is very common,
Yeah.
even for young women who get their earring snagged on something, or Or that woman who was putting her luggage up in the overhead bin and caught her earring and ripped it out on the plane. Like, that must have been fun to be
I
on.
always feel like those stories are made up. I feel like there's something behind those stories that was more related to inebriation, something gone wrong. But
either way.
I mean, how do you get your ear caught from the bag?
Oh, do you know why I wear tiny earrings? Because they get caught on everything.
You mean like if the bag somehow is going up right near your ear?
No, if you, let's say you're doing this, right? And like you have to like reach around.
So the podcast, when you put your hands in the air?
They're watching on the videos.
Okay.
Everyone knows they can understand what I'm saying. When you're putting your bag in the overhead bin on the side of your head, it's really...
You'd have to take the bag.
Yep.
And then literally skive your face.
Well, so what if you're weak and that bag starts to fall back up
Good
at
point.
you?
Good point. Forgot about the weakness.
Side of the face, and then you have to yank it back in.
Okay, all right.
Or it's a backpack and has a fabric strap, and as you pull it over, it could absolutely happen.
And you have some big, like, American Indian feather.
Right, like feathers,
yeah. Okay.
Or your sweater. Trust me, earrings get stuck to everything. Your hair. I mean, it's not... Being a girl is not easy, Dr. Martin.
It's tough. It's tough being a plastic surgeon, too, I was going to tell you. So otoplasty is the ear surgery. We have a good information on that on our website. I'm not sure that we have done a podcast.
We haven't.
We should definitely do that.
Never done one about ears.
Huh. We do have a podcast on dermal fillers, by the way. It's one of our earlier ones. It's actually really good and talks about my approach to fillers and things like that, so you can look at that. But otoplasty, there's really not much. So that's not really an area that you would be like, oh, should I do surgery or not? It's either a yes or no.
Well, let's myth bust a little bit right now.
Mm-hmm.
So a lot of people think that when they have a baby that has maybe really prominent ears, right? You can see that from birth. If they put a headband around that child's head from very early on and keep it there, will that prevent them from needing surgery in the future?
In Japan, they do that, and it's because the estrogen from the mom is floating around in the baby. Estrogen makes cartilage more malleable, and it definitely will improve it, but in most cases, you won't avoid surgery. So it can improve it. It does. You can mold cartilage when they're neonates or newborns.
Babies.
Yeah. But it's only for 2 weeks. So if you wear it for like 6 months, it's like then you got a LeBron James headband, and
right. Like what else?
It's not doing anything. So, which would be pretty funny if you saw your friend's baby all the time had a headband on, but they didn't say that they had prominent ears and trying to play it off as like they're really into sports.
They're trying to be a sports star.
Yeah.
Hoop dreams.
I don't think I've ever seen a baby sweat. I'm just trying to. Have you?
No.
Okay. Sorry.
I mean, yes, like you leave a baby in a
like old man sweat on their forehead.
Never on their forehead. The worst when you pick a baby out of a car seat, their back is just like.
Oh, they sweat. They sweat on the back. I'm just talking about the forehead. Yeah.
No, I've never seen a baby.
And you,
with
as a
sweaty
parent,
brow.
you haven't had kids, but as a parent, you feel terrible when you pick your baby out of a car seat,
I know.
and they're like dripping sweat, and they're like, because they can't talk, and you just basically heated up this child.
They're just like laying there in their little sweat bath.
Exactly. It's usually some dinner party or something, or lunch.
Zoo.
Okay, so otoplasty, that is a surgery, and if you have prominent ears and you want a change, I mean that's really your only choice. All right, jawline and neck.
Yeah, so we'll do all that together. So like the lower face and the neck.
Right.
There are some good non-surgical options now that did not exist even a year ago.
So one of the things we're doing a lot now is Embrace RF. So we have a website, Denver, D-E-N-V-E-R, embracerf.com. It's a microsite, and it can tell you all about it. You can also go on our website, JSmartinMD. We have not done a podcast on Embrace RF.
We've talked a lot about FaceTite.
FaceTite, okay. Well, Embrace RF is basically FaceTite, which is a type of technology, radio frequency. You can go back and look at the Body Tight episode on our podcast, mixed with some external energy. And you do it along the jawline and the neck with a little bit of liposuction. And we've been really pleased with that technology.
And before that existed, we do Vaser on the jawline, Vaser or Smart Lipo, and did get decent results, especially for young people, late 30s into early 40s, when there's not a lot of skin laxity.
Right. And the other option is like mini neck lifts, mini facelifts,
or
a full neck lift. Yeah.
Yeah, depending on where you're at.
This is a hard area. This is the area where it's like, oh, should I do it or not? My feeling about it is if you have mild problems, and I know that's different for everyone, but the skin is okay, but a little bit loose. When you put your chin down, you got some rolls of skin, maybe a little bit too much fat there that you don't want, and that's a common problem. The skin quality, maybe it's a little bit sun damaged and stuff like that. I think the lesser invasive options like Embrace RF or liposuction or even an external treatment like thermage or something like that are great. Thermage, those external treatments are going to give you maybe 10% improvement, and whereas Embrace RF is going to give you 20 to 30% improvement, so it's at least double or triple. But that's the spectrum of less invasive procedures or treatments. Thermage is going to be a treatment. Embrace RF is a procedure in the office under local anesthesia with you awake. And then the next step would be a face and neck lift, whatever you need. And I tell people that's like 80% improvement. So do you want 30 or 80?
And it depends on where you're starting from. I mean, there are certainly patients who come into our office, it sounds great, right? You do some face tight, you're awake, very minimal downtime, you don't have any incisions, you just have a few little poke marks where you
Not
put the
painful in
cannulas
recovery either at all for that.
It's
in most
uncomfortable,
cases.
but
Yeah.
neither is a facelift.
Yeah.
I mean, that's not a
Yeah.
painful recovery either. So, but minimal recovery, a little bit of bruising, a little bit of swelling, very little incision, no drains. It sounds great, right? Yeah, so 60-some-year-old,
up,
right?
sign me up.
60-some-year-old patients come in, they're like, "Oh, great, let's do that," and you're like, "You need a full neck lift."
Yeah.
Like,
And that's the thing, is we're kind of quick to say, just do the surgery. It's the same thing as the eyelids. Like, why are you messing around with this?
right, and the cost difference is not, I mean, yes, it is significantly more to do a face and neck
Yeah.
lift. However, you're going to get at least 10 years out of that.
Right.
Whereas you could try, face tight, and maybe a year later you're like, I still need the facelift.
Pretty much, if you go to a reputable surgeon, your ROI will be greater on a surgery than it would be for these lesser invasive procedures, even though we're like the office that does all these lesser invasive things. So, but we tell people straight up that, we tell them honestly.
Yeah.
And listen, that's why this is not an exact science. That's why there is not a lot of data on this, because it also depends on how you feel.
Yeah, and where you're at, absolutely. I mean,
if you're working a lot
Yeah.
and you're running stuff and you don't want to come in all bruised and swollen for 3 weeks, then do the less invasive thing, and explain to people why your neck is red. I don't know. I mean, it just depends on where you are, but there's no question. Besides mild problems, and that's different for everyone, but just consider mild in your head, moderate to severe always needs the full face and neck lift or the neck lift procedure.
yeah. And that's where I think it's really important for people to understand what provider they're seeking advice from. We have the benefit of having multiple
do everything.
technologies
Yeah.
and surgery.
Yeah.
You're going to a dermatologist, you're going to any other type of doctor who's offering this technology only. Yeah, they're going to tell you this is going to solve all your problems because this is the only tool they have.
Right.
So
They may not say that always, and we work with a lot of different subspecialties, so we're pro doctor.
Oh, yeah, I'm not saying that in a malicious way.
I'm just saying, but
like,
they have a tendency to do that.
They do,
right?
and that's why you need to understand who you're talking
Exactly.
to.
I mean, because they know those things.
Right.
They're comfortable with that.
Right.
You're coming to them for advice, and
That's what they're gonna give you.
They're going to tell you the advice that they know.
Exactly.
They don't do plastic surgery.
That's my point. They're going to tell you
Or
that this will fix your
or they'll
problem.
make a comment like, "Well, I don't do plastic surgery, so but this is what I do," and then you're like, "Oh, that sounds cool," So you don't have to see a plastic surgeon, but why not? Just spend 20, 30 minutes, go see a plastic surgeon, ask them all your questions, and never come back. Someone reputable. All the plastic surgeons are going
don't
to
do
kill
that.
me for saying that, but
Don't do
at
that.
the very least, get the information.
Research your plastic surgeons first and go to one you actually want to see.
And then, whatever. I'm just saying that go see someone that has that knowledge
Yes.
before you do anything. All right. What's next?
So let's do the arms.
Arms are really changing, again, because we're going to seem like we're body tight and face tight fanboys, but they're definitely changing because with the arms was a severe problem in the arms, meaning that you got the bat wings that hang down. There's no other way around it besides a brachioplasty.
Correct.
Which is an invasive surgery. It puts a scar from your elbow to your armpit. We just had a post on Instagram that showed a patient who did the less invasive option, and it has an amazing result.
She's also like 30.
But she also lost a lot of weight.
She
had
lost a lot of weight,
A lot
but
of
she's-
laxity and looseness there.
She did, but she's young.
Okay, I'm just saying. Just
No, but
I mean-
there's, you want to be, I think that you just said we're honest office. We are an honest office. That's not a woman who's 60. She's 30. She has great skin integrity. She
that's
did
a good
lose
point.
a lot of weight.
Right.
And she did not want the scar from
Right.
her brachioplasty.
Right, and she was ready to accept a lesser result.
Correct. And she's gotten a great result.
Yeah. Brachioplasty is amazing. I mean, some of my brachioplasty patients with severe problems are ecstatic with the results, but it puts a scar from your armpit to your elbow.
Yep. It is a
And-
prominent scar,
and
but
you
it is
can't
a
hide that.
complete
Yeah,
solution.
complete solution.
Yep.
So if you're severe, massive weight loss, you're older, and you have really hanging loose skin with or without fat, there's no way around it. You need a brachioplasty. That's a pretty easy decision. If you have nothing there, then doing some external treatments, whatever those are, skin tightening things,
Yeah, like
contour or
Thermage,
whatever,
yeah, all
Thermage,
those, yep.
all that kind of
Yep.
stuff, that's fine.
They're going to provide you some change.
The middle option is where the rubber hits the road,
Mhm.
and that's where we've, like Body Tight, B-O-D-Y, Tight, T-I-T-E. We have a podcast on that, and I also have a microsite on that, denverbodytight.com. You can look up that. But I think that has been really useful
Yep.
for the arms. And that's where I think Body Tight has, to me, had the most remarkable results is on the arms.
Yeah, and the other technologies can work there as well, like Smart Lipo and Baser. Those were the options we used before.
Yeah.
And same thing, like you do get some change. It's never going to be the same as a brachioplasty, but you trade a little bit less of a result for no scar.
Right.
So it's a good trade-off.
Yeah.
Yeah.
Recovery for a brachioplasty is a decent amount of time. Recovery
It
for
is.
the lesser invasive options is probably about half. It doesn't matter. It still hurts for both.
Mhm.
You still have swelling and discomfort, and it still looks a little bit distorted with both. So
Yep.
during the recovery phase.
Yeah, and cost is more with a brachioplasty because you're going to have the OR and anesthesia fees. That is a sleep procedure. Aside from that, though, the actual surgeon's fees are probably pretty similar with most practices because it's about the same amount of time. But OR and anesthesia is definitely going to add on to that if you're doing a brachioplasty.
Yeah, for sure. The cost difference
Yep.
is going to be notable.
Yeah,
wouldn't it?
probably about a third
Yeah.
more with OR and anesthesia.
Yeah, at least.
Yep.
Breast.
So not a lot of great non-surgical options if your concerns are size or droopiness, which for most people they are. Either too big or too small and too droopy.
But InMode says that you can do a Body Tight breast lift.
Well, they're studying it. They're working on it,
But they say,
right? So
where's their white paper?
exactly, that
Written
doesn't
by them.
exist yet.
Yeah,
Doesn't
exactly.
exist yet. And yes, you can do fat transfer of the breast. Absolutely. Fat transfer does come with some other issues as well. It's not possible to always get it perfectly even. Even if you inject the same amount of fat side to side, it's not all going to take. It may not take evenly. It's probably going to require a few revisions to get the fat just how you want it in both sides. That's just the way the body heals. It's pretty much impossible to lift nipples that are pointing at the ground back to where they belong with anything other than surgery.
Yeah, we've used the comparison of a sock that's hanging with a tennis ball in it. If that's literally kind of the appearance of your breast, you can put as much fat in that sock as you want, and it's
Never
not
gonna
going to lift
pull it
the
up.
tennis ball back
Mm-mm.
up. And God bless those women. That's a tough thing. You
Yeah.
need surgery. Breast, almost always you need surgery, right? The fat transfer, we love doing it. We love because we love body contouring. It's few and far between the people that really get value from that,
Mhm.
and we tell people that.
Yep.
I mean, they seek us out for it because we're good at fat transfer, but it's not all there. Using these devices to tighten the breast skin, it's really cool, and I've done those surgeries, and I like it, and it's been interesting, but I don't think by any means it's a replacement.
No,
It's
at
not
least
like
not at this
it's
point.
not like the arms.
No.
The arms are different. The arms, what we just talked about before, that middle option's really there. You don't really have a great middle option for breast yet. And maybe it'll come, but not there. So that's an easier thing. You either need surgery or you don't there.
Well, yeah, you probably do need surgery either way. It's whether you want it or not.
That's my point.
Yep.
Yeah, okay.
Yeah. So
Which
that's-
makes it even harder.
It does, and we have a lot of great podcasts
Sometimes.
talking about breasts about implants specifically, with mommy makeovers. We did one Q&A recently that was a specific question about recovery from breast surgery. So we've done a lot of
We
podcasts
did
about breasts.
implant selection too, didn't we?
We did.
Yeah,
Yep.
that's a good one too.
Yeah,
So there's tons of podcasts. You can go back and look at our catalog.
but surgery is probably the answer.
All right, let's just do the trunk, or should we just do the belly?
I would just do the trunk.
Yeah, okay.
Like,
So the trunk would be your belly or your abdomen, your flanks, and maybe your bra line.
yeah. So the concerns there are going to be fat and skin.
Right. So
Too much of both.
We always address the trunk circumferentially. Other offices, and I don't know why they do this, they just focus on one area. But it's a three-dimensional thing. Like it'd be like you having arm issues, but only addressing 25% of the circumference. Like you have to address the arm all the way around. It's like you only doing the front of the neck and not the side. It doesn't make any sense. So you want to do all the way around the trunk. In almost all cases, that to improve the appearance involves liposuction. In most cases, if you have excess fat there. I mean, the real question is, do you need a more invasive surgery for excess skin? And that's going to be almost always post-pregnancy women, but obviously weight loss patients, both male and female.
Yeah, and it's there again. Most people with excess skin that hangs, if you can grab your excess skin, you're a more appropriate candidate for surgery. Now there are technologies that can kind of bridge the gap a little for some people, whose skin is loose, but you probably can't like grab onto it. It's not touching itself. You can kind of see what you get. And that's where you don't burn a bridge, which is what makes this technology actually really great. So you do some liposuction, you use some technology. We love Body Tight. You could try Smart Lipo or Vaser. They're also going to give you some of that skin tightening and see what you get. And if your skin's still hanging, you probably need a more formal surgery, like a tummy tuck or a body lift.
I think we did a virtual consult, and I think I had Doug put on there more, if you can pinch more than an inch, kind of thing. And that's kind of arbitrary, but if you really can pinch more than an inch and you can kind of grab the skin that much, you're probably going to end up needing some surgical tightening procedure too, like a mini tummy tuck or a full tummy tuck. The other caveat that we didn't mention, if you're post-pregnancy and you have a rectus diastasis or splitting of the muscle, no matter what your Pilates teacher tells you, no matter what any professional tells you, there's no answer to that really besides surgical correction. And I'm not saying you have to do that. You can strengthen your core.
Oh yeah, you can absolutely get your functioning back through exercise.
Well, you can improve your functioning, but it's never going to be anatomically correct. So you take that for what you want.
Yeah, until you repair it.
Yeah.
But for the rest of, for non-surgical options in that area, things that are completely external, not a lot of great options there. I am personally not a fan of things like cool sculpting, VeloShape, those kinds of things. You really...
It's a multi-billion-dollar industry.
It is, but you might as well just get liposuction. I know. And there again...
if you look on the commercials,
it fixes everything.
You can freeze fat.
Pain-free.
Pain-free.
No side effects.
No side effects, and you're so much better. Your life is better. In some cases, you even win the lottery. It's just everything gets better.
Good.
So cryolipolysis is fine. There's nothing wrong with it, but it only makes things, and they may not tell you this, about 20% better at the most. And that's in ideal situations, and that's with stacking treatments.
Right, and that's if your body responds in a positive way.
If your body responds to it. And then there's also something called hyperplasia, which is a negative effect from cryolipolysis, and that's where the fat grows back even more. And we've taken care of patients like that. So freezing of the fat is a great option externally, but it's only going to make things subtly different. And unfortunately, it's expensive.
It's very expensive. And it's not tailored to you, and that's what I always try to explain to patients. The difference between skilled technician doing liposuction, meaning a plastic surgeon doing liposuction on you, versus someone just basically sticking a device on you and walking away, it's night and day. There is no comparison there. The results you're going to get with liposuction in the office or in the OR are going to far exceed what you can get with an external only device.
That's the thing that's so perplexing. It's because people all the time want to do cryolipolysis or cool sculpt, right? You stick a suction cup on and then you freeze the fat. So they do it during lunch. That's a benefit, right? You would consider that. For the same amount of time, if you come in my office, and it's not drastically more expensive.
In fact, in some cases, I think it's probably less because you have to end up doing so many cool sculpting sessions.
So that cool sculpt will maybe make it 25% better at the most, 20. I can make it 70, 80% better with in-office liposuction with you totally awake with local anesthesia. So.
Yeah, and I always just tell people
So basically, we can say for the trunk, we're opinionated on this, that you're going to need some sort of invasive procedure like liposuction or something if you really want to make a big change.
If you want to make a big change, yes. Yep.
Unlike some of the other areas we've talked about where like maybe the neck or the jawline, you can do some external treatments.
Right. With this area, it to really get a big change, and truly the amount you're spending financially, the amount of downtime you're going to have, all those things. Cool sculpting is not pain-free. I don't care what anybody tells you. You probably can't drive yourself back to work after that. You're going to be in a lot of pain.
Right.
Just really, I would say choose the option that's going to give you the most result for the amount you're spending.
Right.
Not the other way around.
All right, so what's next?
So let's address the legs all as one.
Okay.
I'm going to skip over female and male rejuvenation for another podcast.
Yeah, that's fine. And then the buttocks too.
Yeah, so a lot of people,
we can skip over that because
I would consider that part of the leg. To me, the glutes are just the top of the leg.
But the buttocks is basically fat transfer. Some people do implants, but...
There again, it's like lip implants. We don't do implants.
There's really not a no surgery versus surgery option right now for the butt. So it's
there is. The no surgery option is to squat, ladies.
Oh, okay. All right.
Squats, lunges, step-ups, kickbacks.
Okay. We could say that about anywhere that we're talking about today.
No, you do all the sit-ups you want. You're never going to get rid of loose skin.
Right.
You're not going to exercise your jaw into a tighter jaw.
They do have those platysma exercises.
Yes, I've seen them. Same thing if you have loose skin on your arms. You can tone that to an extent, but you're never going to get rid of your bat wing by doing tricep extensions.
Even if you totally roid out and no, tons of protein.
No, and if your glutes are flat and you have not tried to build those glutes, maybe try that first.
Okay.
this is not an issue of skin, you know.
You're really throwing all of South America under the bus now. I mean, you've
Oh,
done.
that's totally different. Those women
cool
probably have
sculpting
super
under the
strong
bus.
glutes.
Okay.
I'm not now. If you have super strong glutes and you still want your butt to be bigger, then fat transfer it up.
Okay.
But my point is, if you are a petite woman who just wants a little bit rounder butt, try doing some hip thrusters. Try doing some squats. Get some
Yeah.
weight on your back.
Very much love hip thrusters. This may be the 4th or 5th time you've mentioned hip thrusting in a podcast, and Nils can back me up on that. At one point, you said you were hip thrusting like 800 pounds.
I think it was probably like 320.
Okay. It's a little bit concerning.
It's probably because I do legs on podcast days,
Okay.
which is every day,
We're going to skip over butt because basically it's fat transfer if you want to make a big change.
which is a surgery.
Which is just surgery. And you can do it in the office, but it's invasive and you got to take fat out.
You gotta get the
By the
fat
way,
from
with
somewhere.
fat transfer to the butt, there's a lot of data coming out about the danger of that.
Mm-hmm.
There's been multiple deaths, not just, you always hear the story of the death of the person who's not a plastic surgeon doing these procedures on other people. These are with plastic surgeons, notable names, like big names, reputable board-certified surgeons. And the patients have had deaths from the fat gets into the circulation and causes
They're
a
gonna
fat
get
emboli.
Yeah. And what are the repercussions also, you know, when we, like with fatty streaks into muscle? You know, that's one of the things that happens with people who are really obese. They end up getting abnormal fatty streaks in their muscle.
Yeah.
So if you're injecting that fat essentially down into those glute muscles, that type of fat is going to form those streaks in the muscle.
Yeah, I mean, I was reading one of the articles recently. It was actually a really good article. It was kind of like a, full evaluation of that procedure. And, they're not saying no on it, but they're saying that
Be cautious.
Be cautious, yeah. And the problem is people want more and more.
Yes.
So the more you put in, the more likely you're going to have one of these bad occurrences.
Right.
So they're extremely rare. I don't want to get people too concerned, but it's something to consider.
Right. So your alternative is to try doing some squats first, maybe throw in a hip thruster or two. And if you still can't build your glutes enough, then seek out surgery.
Okay. So pretty much your answer to any ailment is a hip thrust.
I mean, most,
Okay.
but
So what's next? So the lower extremities.
Let's talk about legs.
This is start off for non-invasive or less invasive. I guess, again, we're getting back into the skin tightening things, getting into removal of fat, like cool sculpting, definitely they use for the inner and outer thighs.
Smooth shapes to address cellulite.
Yeah, or things like that.
And smooth shapes, VeloSmooth, those things do work, but they're temporary. And, if you want your smooth shapes results to last, you got to keep doing it. It's like Botox. As soon as you stop, because it's mechanically, like it is kind of plumping up those tissues, kind of, your suction, that laser, it does kind of heat things up and kind of smooth them out, but that result is very temporary.
Yeah, I think it's reasonable to say that the lower extremities are not great for the less invasive or non-invasive treatments.
Well, because the things
in our experience.
Yeah.
So, unlike some of these other areas we've talked about, if you have problems with your legs, you're going to probably have to consider some sort of surgical procedure. And now, most of the leg procedures we do in our office are done in the office with the patient totally awake under local anesthesia. These are actual surgeries, and we have tons of videos on that on our website. You can follow along on us on social media, but they're going to involve some sort of surgical procedure. Now, they're less invasive surgical procedures, so kind of middle options, more invasive middle. But if you're not someone who has really bad, severe laxity or looseness of the inner thighs and things like that, where you need like a body lift or a thigh lift, then these less invasive options, but they're still surgical in the office, are a great tool.
Yeah, they absolutely are. And I think we should just touch on a thigh lift. Someone who does have a lot of laxity in their inner thighs and the medial leg.
Like if you pinch your inner thighs and you can really pull the skin out, like more than an inch, you get that real loose skin, and it's, especially if you're of fairly normal weight, and that's a problem.
No amount of technology is going to fix that.
Nope.
You need a thigh lift.
Yeah, no matter what someone tells you.
Yep. It just won't. You need that skin excised. And a thigh lift is a pretty major surgery. It's a difficult recovery because of where the incision is placed. It's in your inner thigh.
It's right near your labia, and it goes near your pubic hair, and then it goes back on the crease where your butt meets your leg.
Yep.
So think about going to the bathroom if you're a female.
Sitting.
Yeah. Anybody
Yeah.
sitting.
Sitting.
Yeah.
And it's
Sleeping.
But I will say this. Very, very high satisfaction rate with the thigh lift because it does solve the problem.
Right.
It does not, the medial thigh lift we're talking about now does not address the lower third of the leg.
Yep.
So the skin around the knees is not
doesn't
addressed with the medial thigh lift.
Address the front of the
Nope.
thighs or the back or your butt.
Nope.
And if you've had someone with like moderate to severe weight loss, and severe in a positive way, meaning you've lost weight with bariatric surgery or on your own, you'll need a body lift in a lot of cases, and that's a very invasive surgery. Obviously, there is no non-invasive. There is no question on that. Either you do it or you don't.
Right.
Yeah.
There's no middle option there. Now, there are still doctors who do like a full thigh lift, meaning a scar all the way down to the knee.
And that's for patients with severe skin looseness
Yep.
or excess skin.
And there again, you're kind of trading, like it's like with the brachioplasty. That's a long scar, but
Yeah.
it's a definitive it's a definitive
It
solution.
works great. It doesn't heal great.
Yep.
They tend to have a lot of problems, but
Slow to heal.
when
Yep.
it works, it works.
Yep.
Yeah.
So I think it's important to address some areas of the leg that are not great for surgery. So non-invasive options are kind of your only option.
So that would be the top of the knee.
Yep.
All women, Caucasian women in their 50s and 60s complain about this.
Oh, I'd say they start from the 30s.
Yeah, the excess skin above your kneecaps that's kind of wrinkly and crepey.
And they all think it's cellulite. It's not cellulite. It's just skin.
Right. And every time we've tried to treat that invasively, meaning that like with liposuction or technologies underneath the skin, it's been kind of problematic. So though that area, I would highly advise people use the non-invasive option.
Yep.
Or the less invasive option, something that's done in the clinic with something external.
Yep. And we have a great option in our office that I can't really talk about just yet, but if
Why
you're
can't you
interested
talk
in
about
that,
it? Why
because
can't you
it's
talk
still
about it?
being studied. But there are some technologies coming to market.
You can't say the name?
Not in conjunction with this part of the body.
Oh, because the study hasn't been completed.
Correct.
Okay.
It's not got an indication for that.
Mm.
So there are technologies coming to market that can potentially address these
Yeah,
areas.
because I think that what you're talking about, which I guess can't name, it's kind of like Harry Potter, and you can't name the bad guy with the, what was his name?
I've never seen Harry Potter.
What?
That's Voldemort.
Voldemort.
See, it's because I'm too old
You can't
and
say
I don't
Voldemort.
have
And
kids.
we say him, if you say it 3
Yeah.
times, he shows up or something. So you can't say the name of this handpiece that we're testing out, right?
Correct.
But I think that handpiece is actually going to make a difference.
It could, and the thing that makes it different than some of the other non-invasive technologies, it's not really non-invasive. It has very deeply penetrating pins that deliver energy deep under
Radio
the surface.
frequency, yeah.
So they're getting energy far deeper than you would put it on the face or the neck or any other area to really penetrate deeper into those soft tissue areas to kind of do what they call fat molding or remodeling, to kind of help address some of the skin laxity in that area with the resurfacing component of this device, while also putting energy very deep under the surface to kind of help remodel some of that fat in the area. Great option. Other area that women always want to treat that is really not a great option for much at this moment is kind of that lower to middle third of the front of the thigh, where everyone likes to squeeze it and say they have cellulite there when they're pushing down on it, and you don't. Like, it's just gravity.
Yeah, I mean, we've done liposuction there with energy assistance like Body Tight and other ones, but that's a hard area.
You have to be very conservative,
Yeah.
and you really need to be cautious when you treat that area.
That area more than almost any other area with liposuction. So at the front of the thighs, your thighs in the front, you should definitely go to someone you can trust, like a board-certified plastic
Yep.
surgeon that knows what they're doing.
Because that's a very,
You
I
can
mean,
screw that up.
even we don't treat that area frequently
Yeah,
because
very
it's just,
infrequently, yeah.
Your risks of it being not great
The
are.
risks kind of outweigh the
Yep.
benefits.
Because on most women, it's not as bad as they perceive, and
Right.
there's not a great option to fix it.
Mm-hmm.
Yeah.
Okay.
Calves, implants there again, not something we do, but is done
Yeah,
still.
I mean, there's some people that do it well.
Yep. Go to someone who does a lot of them.
We do a decent amount of liposuction there. Inner
Yep.
knees, we do liposuction.
Oh yeah, the inner knee's the best place
Again,
for
there's
lipo
not
ever.
great options besides something that's invasive, either fat transfer, liposuction, or implants.
But those are great. I mean, a little bit of
Yeah.
lipo on the calves, especially on the inner knees, it can really help kind of just balance the lower leg with the upper leg. If you're aggressively lipoing your inner and outer thighs, you got really bad saddlebags, like hit the inner knees. Like, it's
Right.
no more downtime. It'll really help improve that contour of your leg, like a lot.
So our scan missed a couple of areas, like the hands, rejuvenating the hands.
Feet.
And the feet.
That's 'cause
and then
feet freak me
the genitalia area, there's rejuvenation in that area.
And we'll do a podcast about that by itself. Like,
Yeah.
Yep.
But it was a pretty good scan.
I think it was a good scan.
Yeah, we got most of the body parts.
Craniotomy will be on another podcast.
I think that's what you need with these hip thrusters. I'm not joking. And the fact that you've not
The thrust is a
read
must.
or watched Harry Potter, which is basically in the American fabric. What are you doing?
Isn't that British? She's British.
No, I mean, it's British. I mean, it's whatever. So that's it. So, that was a kind of very extensive, and hopefully everyone's not asleep right at this moment, but at least it tells you kind of the different areas where surgery is more likely and the other areas where surgery can be kind of pushed off or not done at all. It's very difficult to make decisions. If you want pure data, it's not there. And I hate to say that about my field, but that's just the way it is. So what you have to do is take the data that is available Do your research. Amy always says that. You know, Google is your friend. You have to put it through a discerning eye, because a lot of the stuff on the internet is not correct.
It's
but
very
at least
sensationalized.
Sensationalized, and especially in social media, and you know, we're culprits of that sometimes. The way you say things and present it, it's more rah-rah, and you get excited about it, like body type, which we like. We love that technology right now. But you know, you have to take it with a grain of salt, get as much information as possible, see the experts, and it's okay if you see a dermatologist or a subspecialist that's not a plastic surgeon, but if there's any indication that you may need surgery, go see a plastic surgeon.
Yeah, get a second opinion.
Yeah.
And if you are seeking out a technology-driven thing, go to somebody who uses that technology a lot.
Right.
So if it is a dermatologist, especially if it's skin resurfacing, like heck yeah, a dermatologist may use that way more than a plastic surgeon.
I've done that before. We do skin
Yep.
resurfacing, and patients come from a dermatology office that I respect.
Send them right back.
And they're
Yeah.
like, yeah, they told me to do this. I'm like, then go
Do
right
it.
back and do it. You
Yeah.
don't have to do our stuff. It's the same thing as we teach body type. So why would you not come to me when we're a regional center, right? I know how to use this stuff. So it is good to get different opinions, good to do the research, ask your friends, and then probably an important thing that we really didn't hit on, but we kind of touched on a little bit, is that you need to know where you are mentally. Because a lot of people come in, they're like, I want surgery, then I don't want surgery. I want surgery, and then I don't want surgery. And they're really going through their own personal thing about, is this worth it? Am I being vain for doing this? What would my kids think?
Right.
You know, is this money should I use this money for something else? So those are all valid questions. I have an answer for all those, but just think about those before you go in, and at least in our office, you can talk about that with us, and we can go over it with you. What else?
Yeah, that's it.
All right.
We've kept them long enough.
So education, empowerment, transformation. So we talked about the education, we empowered you with information, and now you can go off and do your transformation. We appreciate your support. Our analytics are improving. Please rank and rate us and all the other stuff. You can follow us on social media, Jason Martin MD. We have a website, same name, Jason Martin MD. We're going to be having a website for our podcast.
Yeah, well, and we are on Instagram at Beauty and the Surgeon Podcast, and also coming soon, beautyandthesurgeonpodcast.com. Holla.
It's going to be huge.
We're on Facebook too.
All over it.
Yep.
We're taking over social media
Like,
and the
comment,
internet.
share us with your friends.
There's really no other podcast on the podcast ecosphere like this, but they are coming up, and we welcome those, because I think it's really important to get real information out there for people who are considering plastic surgery, but more importantly, who want to better their lives. And that's what we're trying to do. So in the future, we're going to do more plastic surgery things, but also things related to health, fitness, and most importantly, besides hip thrusters, nutrition, because we've never done a podcast on nutrition, and Amy is so knowledgeable in that, so we need to do that soon.
That'd be cool.
You down with that?
I am.
All right. See you later.